Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us today. Today on Community Health Heroes, we'll be speaking with Senator David Heitmeyer, State Senate District 7, who will share information about the state of Louisiana's health from a legislative perspective. Dr. Kevin Kirschner, a neuro-ophthalmologist, who will talk about vision health in general and how 3D movies might be able to help you detect underlying vision problems. And Kane Daigle and Dr. Jake Rohde with the Diabetes Prevention and Control Alliance program of YMCA of Greater New Orleans, who will talk about how this valuable program is helping people in our community prevent and control diabetes. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
The Louisiana Legislature just adjourned its 2014 session on June 2nd with several bills affecting the health and well-being of Louisianans. Joining us today to give us an overview of the session and talk specifically about what his office is doing to ensure that all Louisianans live healthier lives is Senator David Heitmeyer, Louisiana State Senate District 7. Thank you so much for joining us today, Senator Heitmeyer. Can you tell me what came out of the recent legislative session?
This past legislative session was really kind of uneventful legislative session as far as where a lot of contentious issues come. We had some issues as far as the legacy lawsuits, as far as some of the landowners' issues, but again, health and welfare was probably the other than education, was the area where most bills were filed. We had Senator Nevers had Louisiana First piece of legislation to try to provide some health care for our most vulnerable populations. We were able to help fund the Noki clinics in Orleans, Jefferson, and Plaquemines Parish, include some additional dollars for the FQHCs around the state. And we've had numerous bills from healthcare, everything from issues as far as abortion to immunizations, to bills that were just associated with the overall everyday healthcare, such as obesity legislation, smoking legislation, creating committees for obesity to try to improve Louisiana's healthcare rankings.
Right, and we're going to get to that in a moment. But can you tell me something specific that we did about chronic diseases such as diabetes and heart disease? What bills were passed?
Well, what we were able to do in this session is United Healthcare rankings, or United Healthcare. I called them last year, and we started to talk with Reed Tuckerson about our needs in Louisiana. When we look at the rankings, we ranked 49th in the nation. And so we had conversations about how could United Health help. And so we talked about different things, and they were very gracious to give us a grant. They gave the state a grant, and what they did is we looked at the different public health institutes in our state, and we placed a $100,000 grant with Tulane School of Public Health, and we started looking at all of our public health policy. We developed a package of 10 pieces of legislation that was everything from being able to use WIC vouchers at farmer markets, to allowing farm-to-school programs to allow schools to purchase directly from Louisiana farmers, to complete streets, to obesity select committees, obesity commissions, smoking as far as stopping smoking in K through 12 within the school grounds. So it was a complete package looking to enhance the overall healthcare rankings of our state, with specifically looking at smoking and obesity.
And also childhood obesity?
Childhood obesity is going to be part of the process, because as we create the committees, and the committees are two components. The first is a commission that's going to be made up of about 10 entities around the state that are going to try to defragment how we spend our money as a state in each community, local community, to address obesity. And so those committees, or that commission, will look and see how can we do a better job of spending the resources that we presently use on obesity. Because we know that obesity leads to heart disease, obesity leads to diabetes,
right,
hypertension. So there's many health consequences with obesity. And the next component, what we were able to do is create a select committee in the legislature. And the legislature committee is going to consist of representatives from the Health and Welfare Committee. We also combine education, the Education Committee, so that we can help hopefully address a lot of the childhood obesity with education, and also the transportation component, so that we can address the complete streets with sidewalks, paths. We all know as communities that have more sidewalks and paths have a tendency to be less obese.
Right, and healthier in general. And so United Health Foundation had come out with a ranking last year that ranked us tied for last, really, 49th. But they also gave you some suggestions and hints, especially around smoking. Can you tell me a little bit about that?
When we look at the metrics, smoking carries the highest weight of any metric, and it's about 7.5%. So what we're looking at trying to do is decrease the amount of people that smoke. Smoking is, directly correlated to, we can directly correlate smoking to, 600,000 deaths in the United States. So what we're looking at doing is how can we do that? Last year, what we were able to do is pass a piece of legislation that allows all of our college universities to develop their own smoke-free policy. That will take place this year. This past session, piece of the legislation that we worked on was K through 12. And now K through 12, what would happen is some schools had some areas where they could just walk right outside of campus and smoke.
Right,
and so we created a 200-foot barrier from the school property to where smoking will not be allowed. And hopefully we will see less smoking in the K through 12, less of a habit being developed, and basically saying smoking's bad for you.
Is that for the whole state of Louisiana?
The entire state.
Could you tell me a little bit about the new hospitals and the progress the two new hospitals are making?
Sure. There's two hospitals together. There's going to be UMC, which is going to be run by Children's. That's going to be a 444-bed state-of-the-art facility, over 2 million square feet of healthcare services. So that is scheduled to be finished in 2015, in the spring of 2015. The VA is scheduled sometime in 2016. That's going to be close to another 200 beds. So we're going to be increasing capacity and hopefully increasing healthcare access.
And is that both general medical care and mental health care, or is it just general?
Yes. Of those 440 beds, I believe 60 are psychiatric, and on the VA of the 200, I believe 20 are psychiatric. Right. So we definitely are addressing the mental health concerns also.
Senator, can you tell me what passed this session about breastfeeding and promoting it in public places?
Oh, sure. There was a bill that we carried. Again, it was part of the package from Tulane that was sponsored by United Health. It was a bill that would increase the number of lactation rooms in state buildings. So what we were able to do is increase the number of rooms from 10 to 20. And we know that when we decrease barriers for breastfeeding, that we're basically promoting much healthier kids. And the data is just so staggering as far as children that are breastfed up until 6 months, that their health rankings or their health status is significantly better than those children that are not. So it's just a way that we can reduce some of the barriers to breastfeeding and promote healthier kids.
Oh, absolutely. That's a phenomenal idea. And then I also understand that there was some legislation that was passed regarding blind vendors.
Yes, there were. That is something called the Randolph-Shepard program. The Randolph-Shepard program is a federal program that allows for our disabled individuals to promote work. And it allows them to run the cafeterias in federal buildings. And what we were able to do is pass legislation that will enhance training so that we can take people that are visually impaired and give them the training necessary so that they will be able to operate some of the cafeterias and some of the snack bars and things like that in the federal buildings. So we're increasing the amount of training that they can get so we can increase the pool of blind vendors that we can actually put to work, and other disabled individuals too. So ultimately we're creating jobs for our community of disabled individuals. It is something that is quite exciting. The blind vendors were very excited, especially with the training and the training component in increasing the jobs, and hopefully get them to a level of independence. So it was quite a very fulfilling piece of legislation.
I would say so. That's awesome. And also I understand there's something called Complete Streets that's coming up.
Complete Streets. Again, Complete Streets was another component of the package that United Health sponsored. Complete Streets is the idea of trying to take a community and make it more active. So when we put a street in, we're also looking at the complete aspect of transportation, from bicycle paths to sidewalks, and to allow our disabled individuals for wheelchair access. So it promotes activity. And we know that when you promote activity, you make the community a much healthier community. And so it is, again, we were able to take policy and put it in statute so that now in Louisiana, whenever a street is built, that we're going to be looking at how can we make that street a complete street with bicycle paths and sidewalks to make our community more active.
I really appreciate you taking the time to join us today, Senator, on our show and providing this valuable information to our audience.
Penny, it's been a pleasure being here. Thank you so much. Look forward to coming back.
Thank you so much, Senator. And we'll be right back with more Community Health Heroes.
So this is my computer.
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. When I say dot, I want you to just push the period.
She's gonna love me all over again now.
That's it. Jamaica, here you come.
Here we go.
Good job.
Alright. Thank you. Thank you. And I did it by myself. Feel smarter.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
According to a recent report by the American Optometry Association, about 1 in 4 children might have visual problems that can be detected with 3D viewing. So you now have another reason, besides entertainment, for taking your kids to see the latest 3D summer blockbusters like How to Train Your Dragon Part 2 or Spider-Man 2. Here today to tell us how you might be able to potentially detect any underlying vision problems and what you can do to protect your overall vision health is Turo ophthalmologist Dr. Kevin Kirschner. Thank you for joining us today, Dr. Kirschner.
Thank you for having me on the show today.
Dr. Kirschner, we often get asked this, but can you tell our viewing audience the difference between an ophthalmologist and an optometrist?
That's actually a very good question because a question the community has posed a lot of times on what that difference is. Both an ophthalmologist and an optometrist provide eye care services in the community, and oftentimes they work in the same offices together. An ophthalmologist, like myself, is a physician who is trained to medically treat and surgically treat eye care problems. An ophthalmologist has attended 4 years of college, including their pre-medical training, 4 years of medical school, 1 year of a medical or surgical internship, 3 years of ophthalmology training, where they learn to medically and surgically treat all diseases of the eye. And additionally, some doctors, after finishing their ophthalmology training, go on to do fellowship training, which can be 1 to 2 years in surgical subspecialties of the eye. For example, I did a fellowship in oculoplastics and neuro-ophthalmology. Now, an optometrist is also an eye care provider, and an optometrist did attend 4 years of college, but instead of going to medical school, they attended 4 years of optometry school. An optometrist is licensed to perform eye care exams and to diagnose and determine visual problems in the eye.
Recently, we've had an awful lot of 3D movies out there, and some folks are complaining about visual problems when they watch the 3D movies. What can you tell me about that?
Certainly. As a father of 3 children, my wife and I fully understand the excitement surrounding 3D movies, especially in the summertime. And also like to mention, we have an IMAX theater in New Orleans, and they're frequently playing 3D movies down at the center there too. One thing that potentially a parent or a person would need to look out for are signs and symptoms of a visual problem while watching a 3D movie. Some of those signs and symptoms could include, number 1, developing a headache when you're watching the movie. Number 2, if your eyes became tired or you're developing some eye strain. Number 3, if you're just feeling some motion sickness or maybe a little bit of nausea. And number 4, if you just didn't feel like you were seeing very well or not enjoying the movie quite the same way that the person sitting next to you was.
Mm-hmm. Well, what causes that? What causes like the headaches and the eye strain when you're watching a 3D movie?
Well, for our eyes to appreciate the 3D technology, they need to work in coordination together. And when eyes are not working in coordination together, we're unable to have appropriate depth perception, which are needed to fully enjoy the 3D movie experience. Now, there are lots of things that could potentially cause problems with lack of coordination of the eyes working together or a depth perception problem. Number 1, a patient could have an uncorrected refractive error, and that could be simply just correcting a patient who's nearsighted or farsighted with glasses or with contacts. Mm-hmm. But some of the more severe things that we need to look out for is if a patient's developed amblyopia or also what they call lazy eye, and that's when one eye is not quite as strong as the other eye. And then the third thing is if there's a motility disorder in the eyes, if the eyes aren't working together to help create that binocular vision. All those things are real important to look out for and have examined because they could lead to further permanent disabilities if not identified.
And how soon after somebody watches a movie and they see that they have either a headache or strain or they just aren't seeing it properly, how soon should they come in and see you?
Good question. I would recommend as soon as possible, especially in children. That's very important because the visual system in our brains is still developing up to 6 and 7 years old. So it's very important that we identify these problems early because they can be treated with glasses, potentially with patching, or even it may become a surgical issue. So we certainly recommend that if a patient is experiencing the symptoms that I previously mentioned, it's important to see a eye care provider so they can have a full comprehensive eye examination.
And I understand that about 6% of medical conditions can be detected with an eye exam. Can you tell me a little bit about that?
Absolutely. One of the things that really drew me to ophthalmology, and one of the things I'm really fascinated in ophthalmology, is a lot of systemic diseases first present in the eye. So when we're doing a front-to-back comprehensive eye examination, a lot of times you can detect problems that can then be treated by either the ophthalmologist or a primary care provider. For example, in the area that we live in, there's lots of hypertension, there's lots of diabetes, patients can develop carotid stenosis. Those can all be identified first in the eye. And then certainly autoimmune diseases, infectious diseases, inflammatory diseases. There's a whole spectrum of things that an ophthalmologist can detect and start getting the treatment and the ball rolling right away to help not only save a person's vision, but to save their whole body well care.
And there's even types of cancers that can be detected that way?
Absolutely. Certainly the whole spectrum of cancers can, very many of them can be present in the eye, and we can get that treatment rolling.
And if our audience wanted to know how could they get in touch with you or eye care provider, how would they go about doing that?
Well, certainly some good information that I would like to provide on a website would be the American Academy of Ophthalmology. They have sections both for physicians and for the community at large. I work at next to Turo Infirmary on Britannia and also have an office out on Houma Boulevard. And we have I work at a multi-specialty practice called the New Orleans Eye Specialist. We do have a website and also have a Facebook page.
Awesome. And I had one more question. How often should somebody, say they're not having eye problems, how often should they come see you?
Good question. We get asked that a lot. Pediatricians do a great job when new baby eye exams when they're born, and then certainly during the newborn well baby care. And so if a problem's detected, typically that gets referred right away. But I think the recommendation by the American Academy of Ophthalmology is that school-age children should have a baseline comprehensive examination, because like I mentioned, as a visual system is developing in the brain, if there is a problem, you want to catch that early.
And how about for healthy adults? How often should they see
Healthy adult
you?
every 1 to 2 years is for a full dilated exam.
I really appreciate this valuable information, Dr. Kirschner. I thank you for being on my show.
Thank you, Dr. Walker. I enjoy being here.
And we'll be right back with more Community Health Heroes.
Packers, Vikings,
Red State, Blue State.
we come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country. Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Storms come up fast. Take time for storm protection now. Reinforce your roof. Make sure you're adequately insured. Shutter windows and other openings. Elevate your home if you live in a low-lying area. To learn more about how you can protect your family and property from storms, visit getagameplan.org and click on Mitigation Plan. Louisiana, we can do this. This mitigation message brought to you by the Governor's Office of Homeland Security and Emergency Preparedness.
Did you know that 1 in 3 individuals in the United States have prediabetes, but only 11% know they have it? Join us today to tell us about resources available for pre-diabetic people in our community who want to prevent or control diabetes is Kane Daigle, health, well-being, and chronic disease specialist with the YMCA of Greater New Orleans, and Dr. Jake Rohde, an Ochsner family physician. Thank you for joining us today, Rohde and Kane. I really appreciate you're taking the time to come and join us. Can you tell me a little bit about the diabetes prevention program?
Sure. So the YMCA's Diabetes Prevention Program has been going on for about 1.5 years now. We partner with United Health for this program. It's a program to help those folks reduce their risk of developing type 2 diabetes. So it's adults 18 and older, helping them lose 7% of their body weight and increasing their activity through a 12-month program.
And how do you get patients enrolled in your program?
Most folks either attend screenings or visit their physician, or we actually have a risk test developed by the CDC, which is online on our website, and they can actually just go in and click, yes or no for about 6 or 7 questions, and it's emailed straight to me, and then I can contact them immediately if they qualify, or if they don't qualify, either way, and enroll them that way. And then there's tons of information about the program on our website. And in any of our local YMCAs.
Now, I understand Monsanto and Luling has some type of program similar to this?
Yeah, so we're actually holding the program at the Monsanto plant in Luling. A good thing about this program is that it's mobile, so we're able to go out into faith-based communities and worksite places and have this program. So we went to Monsanto and we screened over 100 of their employees. We had over 30 enroll in the program. Yep. And just what I like about this program at Monsanto is it's a true testament to what the program is about. It's a group of individuals who meet once a week for an hour, and they're really working through the barriers and the challenges in their lifestyle to create healthier habits in their lifestyles.
And they have the support of each other.
Exactly.
Phenomenal.
Yep.
And so if somebody thinks they may have diabetes, what are some of the signs and symptoms that they would see or experience?
Well, diabetes symptoms are interesting because they're very generalized and they're often very late in coming. So if you're having diabetes symptoms, which the most common ones are blurred vision, you have a greatly increased thirst, and you're actually running to the bathroom quite a bit. I mean, those are the classic hallmark signs of diabetes, but usually by the time you're doing that, your diabetes, not only do you have diabetes, but you have really bad diabetes. So that's why it's so important, like what Kane says, and to partner with this program, which I did very early on, and I'm trying to champion the program because, it's just, there's usually no signs for prediabetes, and for early diabetics, there's almost no signs or symptoms that are reliable. So the only way that we can really find those patients is to screen them through the questionnaire or going to your doctor or knowing your family history. Family history is so important. So, and even people without family histories who live down here and eat the way we do and carry, that BMI that's greater than 25, that automatically almost puts you at very high risk for prediabetes.
So besides the BMI being greater than 25, what are some risk factors that people have?
The family history is big, so anybody in your family having diabetes. Some of the other risk factors are, if you're a female and you ever had like gestational diabetes during pregnancy, if you ever had any kind of a glucose issue, which is the sugar that we measure in the blood. If anybody's ever told you that, there's some specific symptoms. If you get tired, dizzy, if you feel very, if you can't get through a day, a lot of things like that we look for. But they're very generalized, and a lot of patients, if you ask them these symptoms, pretty much almost everybody has them. So that's why it's very, important to get these screenings done. And that paper that Kane has is very comprehensive and goes through, a lot of the risk factors, and you get a nice little score, and it'll tell you if you're, if you qualify for pre-diabetic.
And why is it so important if you fail that test or you have some of those symptoms to see your doctor right away?
The impact of diabetes, unfortunately, is very high, and it affects every body system. And although we can, with weight loss, say that you're well controlled, once you become a diabetic, we can't ever say you're not a diabetic. So finding the pre-diabetics and making sure they never become diabetic, or at least that you become diabetic maybe 5 or 6 or 10 or 15 years down the road is so much better than, them becoming diabetics right away. So the earlier we could catch it, cost, medication, morbidity, mortality, we say, is greatly reduced.
Well, this has just been incredible information, and I appreciate you serving our community and taking the time to come to this show today.
Thanks for having us.
Yes, thank you.
And we'll be right back with more Community Health Heroes.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
And she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Thank you so much for joining us. If you would like to suggest a health topic or send us information on your health organization's events, please visit our Facebook page or email us at communityhealthheroes@gmail.com. We hope that the information we provided today will help you and your families live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.